Cardiovascular diseases and biohacking modalities. What do I think about them? Well, I'm going to give you a few key points on some things you need to be aware of and the huge mistakes that I see out there. That's kind of like, hey, you might not be able to do this because it's super dangerous for you to do this. And it doesn't make sense for someone to do it and have that risk. So, if you have a cardiovascular disease, first of all, this is section one, obviously, for tip one. You need to have a primary care doctor and a specialist making sure that you are in well management, meaning your medications, everything else is well managed. And tip two, you need to be monitoring yourself on a regular basis, collecting data. Meaning, I'll give you a prime example. Blood pressure is the easiest one to collect data in. And aside from other comorbidity stuff, check your blood pressure in the morning. Check your blood pressure before activity. Check your blood pressure during activity. Check your blood pressure after activity. Check your blood pressure when you have a stressful event. Check your blood pressure. The more information you write down in your journal, including everything else, meaning if you have a comorbidity like diabetes or you have to regulate certain aspects of everything else, the more data you collect in a little journal, which you should have, the better it is for whoever's taking care of you to understand how you've been changing and evolving. We're going to use the word evolving. But it is better because as you get healthier, your medications need to be adjusted, whether it needs to be adjusted to an earlier time or a lower dosage or different times in the day, or there needs to be a different set of medications that they have to provide you. But this is important for your care physician to have. And this is something that people forget to do because as humans, we don't want to do this. Who wants to spend their whole life writing down in journals and figuring out data points? Only psychos like me, right? Want to be Power Ranger with two bracelets, a Whoop and a Fitbit. So this is something that should be done for everybody when you have a cardiovascular disease or even any other disease. And then you jot down how you feel from day to day, from morning to night, and especially how your training is and how you feel the next day when you recover from that. So these are things that are very important. Okay? Tidbit number, what are we, number 3? So tidbit 3 is when you do biohacking stuff, you need to be aware that a lot of the biohacking stuff could put you in the wrong place at the wrong time. What I mean by it. So, example, saunas. Saunas are amazing, okay? But they're also vasodilators. So, and also they will dehydrate you, okay? So it's kind of like a combination of the two. And if you're on a low sodium diet or a DASH diet or whatever you want to call it, when you get into the sauna and you vasodilate everything and you're on a dilated medication or supplement that your physician has prescribed you, what do you think your blood pressure is going to have, just do? It's going to drop because everything dilates and you have a higher chance of passing out. Same thing with drinking a lot of water without sodium or enough potassium, or not having enough potassium or sodium when you're on a DASH diet. You get hyponatremic, okay? And you can lower your blood pressure again. So now it's 2 things that will lower your blood pressure aside from the medication. So that's 3. You could pass out. And that's why there's a warning on saunas and hot tubs not to exceed more than 15 minutes. That's why there's a warning like that. And that's something that people forget, especially nowadays that everybody just wants to do these modalities. Another biohacking tool that people kind of forget and don't pay attention is cold plunging. So when you have a cardiovascular disease and you're going to cold plunge, cold vasoconstricts. Plain and simple, vasoconstricts. And something that we forget to even realize is that if you have high blood pressure, okay, or narrowing of an aorta, or a narrowing of anything, that's related to coronary arterial disease or anything like that, anything narrowing in your arteries, what would happen if we vasoconstrict something for a prolonged time? You get a ischemic-like response. You're not going to get necrosis. That's frostbite, and that's with these cold plunges. It's very hard to get into frostbite, but I'm not saying it's not, but it is. Like it's too difficult to do it. But yeah, necrosis. So you could pass out if you don't have well-managed cardiovascular disease, or it could be very strenuous on your body, extremely strenuous, super shocking, right? So when you have vasoconstriction and then you stress the hell out, you could pass out. A good example is this is something that's been known for a long time, where you have older people in colder environments, and they go outside and they start shoveling their driveway, and then all of a sudden they have a heart attack. Well, yeah, because if they're older and they have managed diseases, regardless what it is, you're vasoconstricting, you're already stressing the body as it is to try and pump fluids, try and move the hemodynamics of your body, and then you're trying to do something that's aggressive, okay? So like shoveling snow out of your driveway is not something that's just like easy to do. You have to put effort in that bitch, okay? You're putting in a lot of work. You're actually going down, shoveling, going down, shoveling. And I think that's equivalent to about like 5 point something mets for anywhere between like maybe 30 minutes to an hour, depending on how much you move. Imagine, that's a lot of mets with vasoconstriction that's already stressing the heart. Man, you fatigue out, you pass out, or you get a heart attack. Like, these are the things to consider when you do biohacking things. So that's why you still want to double check whoever is managing your health, whether you could do it or not. There's ways around it too. You can microdose these things. What I mean by microdosing is start off with nothing so hard. If you want to get into cold plunging and you live in, for example, Miami, that's 90 something degrees every day for all year long. Well, start with a shower that's at 70 degrees, 68 degrees. The coldest showers could get to is about 60. I might be wrong, but that's enough of a shock to learn, and do that for a minute and see how you feel. But you would dosage that response. Same thing with saunas. You would dosage the response and make sure that you're not hurting yourself, including with the advice of your medical professional. These are things to notate when you do any of these things. Yeah, just be careful of this stuff, guys, because it is not fun. And it's very scary. And then I guess I'll throw in this bonus. When you're doing this type of stuff, the newest testing that's out there, all these things like VO2 max is a good example. VO2 max is still a stress test. It's still a stress test. You are measuring the response that you are giving the body via stress and how your body responds to that stress at that given time, whether it's a bike, row, treadmill, whoever's doing it. So then the issue is that most of these people do not realize that if someone is a high risk, and it has to be vetted, it should be a submaximal test. Okay? And there should be some form of clearance depending on how much risk factors this person has. Okay? If someone has major risk factors, I'm going to definitely get this shit cleared before I have you do a VO2 max test. But if you have moderate and low risks, then great. They could potentially do the test as long as they realize what is what. Or not do sub-max tests. I do a bunch of sub-max tests for this reason. When I do these events, it's a sub-max test because I do not want to do anything crazy during one of these events. So keeping it simple, pay attention to that, and then you would do these VO2 max testing every 4 months to see if you're actually doing something. 3 to 4 months. The more athletic, the longer you would want to do the test, right? The more in shape you are, the longer you want to have distance between any type of data collection that you have. And then obviously the more sensitive the data, the actual physiological data that you're trying to collect, the more times you would test. So like blood work is more sensitive than someone changing their VO2 max. Okay. Body composition is less sensitive than VO2 max testing. So it really depends on the sensitivity of the data that you're collecting, how frequent, but the more in shape you are, the longer you could prolong all these tests. And again, that's with guidance of whoever is managing your health, if you have someone managing your health. Okay, hopefully I gave you guys enough tidbits, especially within the cardiovascular space and biohacking stuff. I'll probably revisit this topic again because there's so much, but I need to do my due diligence and look up all these journals that are coming out with more of these modalities and those retrospects. But yeah, that's one of the biggest problems. They use healthy populations for these testing modalities, at least some of these people that use data collection, and they don't really pay attention to everything else, right? All right. See you guys for the next one.